Yeah.
I mean, look, I guess Google is now like for a long time now, they usually put like the official like SAMHSA government thing at the top of, that these advertisers don't get to come out above that. But I don't even know if that organization, I don't know if SAMHSA, I think it's SMA, whatever it is, SHA, that, the organization that deals with part of what they deal with is addiction. But I don't even know if they differentiate, and would help someone in that situation. For all I know, maybe they just send them to rehab. But yeah, it's difficult. I mean, are there like a lot of experts or science like that people can look to learn more about, like, how this works, like why tapering has to be done very gradually?
I mean, the Ashton manual was kind of like the old school, like landmark document that existed since the 90s, when she had a clinic over in the UK where she worked with patients to withdraw them slowly. And then she wrote the manual based on her experience with those patients.
Yeah.
So that's kind of the first document that exists that explains this. Although she didn't go into the difference in language, the difference between physical dependence and addiction in that document. And I think she used addiction language incorrectly in that document. So now we have, as of this year, the Maudsley deprescribing guidelines that were just released. And that the authors of that are Mark Horowitz, who's a psychiatrist in training in the UK, and Dr. David Taylor, who I believe is a psychopharmacologist who's well known in the UK for his work. And Maudsley is a very respected textbook in the UK. The textbooks by Maudsley prior to this one are all called Maudsley prescribing guidelines. So it's all for psychiatrists and doctors about how to prescribe psychiatric meds. So the latest one is the Maudsley deprescribing guidelines. It's the first of its kind, and it's incredibly detailed and thorough, because Mark, who is one of the co-authors, is a psychiatrist in training, but he's also a patient. And I've heard him say he considers himself a patient first because of what happened to him trying to withdraw from psychiatric medications, including benzos and sleeping pills that he was on. And so he's written an incredibly thorough textbook about all the different ways that people are tapering these drugs at home on their own. And he had contributors to the book. I helped with the benzo section. Dr. Christy Huff, who's passed away, but was our medical director at BIC, also helped. And I think he has in there, gabapentin, Z drugs, benzodiazepines, antidepressants, everything that needs to be tapered slowly at home on an outpatient basis. So this can be bought, and you can take it to your physician if you're a patient out there and you find yourself in this physical dependent state and having trouble withdrawing. You can educate yourself with it, but you can also take it to your doctor or PA or nurse practitioner and use it as a tool to sort of convince them, like, hey, this is a well-respected textbook with all the information that we need to safely get me off of this stuff at home in the way that it's supposed to be done. So that doesn't mean you're guaranteed to have still an open-minded clinician who's going to read it and listen to you, but at least it's sort of a tool in your toolkit to try to be better understood and taken seriously.